Rim 15 is 7 cm superior to the centre of the umbilicus, on the midline. Kidney 24 is in the third intercostal space, 2 cm lateral from the midline. Liver 13 is located just anterior and inferior to the free end of the 11th rib. To locate the free end of the 11th rib, palpate up the lower margin of the rib cage till you get to the first free floating rib, which is the 11th. This point is never inferior to the umbilicus and never posterior to the mid-axillary line.
Do20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do20 is located 1 cm posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other do points, so don't be tempted to go further back than 1 cm posterior to that midpoint.
So moving from large intestine 2 to large intestine 3, over the head of the second metacarpal joint into a significant depression. Again, the hand should be loosely flexed, so in a loose fist, and you should fall into that point. Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpal ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in. Heart 9, at the radial nail point of the little finger. I'm going to feel for the flare. Look at where the proximal and radial borders meet. Look at where the nail bed is and put my point in. Pericardium 4 is on the flexor aspect of the forearm, on a line connecting pericardium 7 with pericardium 3. It's 5 cm proximal to pericardium 7. In between these two tendons, palmaris longus and flexor carpi radialis. As you get to this point, the tendons start to go deeper within the body, so it may be a little bit more difficult to palpate, but remember you're going on a line from pericardium 7 to pericardium 3 to help you. Pericardium 6 is on the flexor aspect of the forearm. It's 2 cm proximal from pericardium 7, and it's in between the two tendons, palmaris longus and flexor carpi radialis.
Kidney 9 is located 5 cm superior to kidney 3 on a line joining kidney 3 and kidney 10. The channel is starting to move a bit more posteriorly here. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella.